Though caring, compassion, and spiritual care and ethical decision-making are expected of the professional nurse, this emphasis is typically not integrated into the curriculum and is often left to chance. Clinical dilemmas are a new series of clinical reasoning case studies that I've created that emphasize the art of nursing and integrate aspects of caring, spiritual care, nurse engagement, and ethical decision-making, and its relevance to nursing practice. These case studies can be used in the classroom as an active learning tool to develop the ethical comportment of nursing, as well as in post-conference in the clinical setting. Students will develop clinical reasoning as they identify what clinical data is relevant, determine the nursing priority, and resultant nursing interventions. These 14 case studies are derived from themes I've experienced in clinical practice and represent the most common clinical dilemmas a nurse will likely encounter. They're divided into the following 4 categories of ethical dilemmas that include studies on medical futility, patient care dilemmas, treatment care dilemmas, as well as nurse dilemmas. And today, I will present a nurse dilemma of incivility, which in this context is student to faculty incivility. And here is our scenario. Susan is a 21-year-old first-year nursing student at a local community college. She consistently received A's without having to study at length in high school and continues to work 20 to 30 hours a week as a nursing assistant to avoid having student loan debt. Nursing is much more difficult than she expected and has been overwhelmed by the amount of content that she needs to know and how much studying is required. Despite using all available time in her schedule to study, Susan has been averaging 80% on her exams, and if she does poorly on the final, she may fail the program. Susan has been increasingly frustrated by Joan, her current classroom instructor, who she feels is the reason for her poor examination grades this semester. Instead of addressing her concerns directly to Joan, Susan openly shares her negative opinions of Joan to others, as well as on her Facebook page. Numerous students share her negative assessment of Joan and like her comment that Joan is the worst instructor ever who should go back to clinical practice where she belongs. Now, let's look at this scenario and say, using the lens of clinical reasoning, what clinical data is relevant and has significance to the nurse? And in this context, Susan is 21 and a first-year nursing student. And I think what's significant here is to recognize that a younger student tends to be less mature, as well as has less life experiences to handle the stress and rigors of a difficult major of nursing, which again needs to be considered by the educator. What else is significant in my lens is that she's received A's without having to study at length in high school and continues to work 20 to 30 hours a week to avoid having student loan debt. Now, I don't know about your class, but I see many students who struggle with the A grade that they are used to and at times feel even entitled to. And when that grade isn't there because of the amount of work that's required, students can get either own that or they can get angry and start to blame someone else, in this context, the educator. She's also working up to 30 hours a week. And I am blown away by how many students still want to kind of spin the platters. Something's going to fall over time. You don't have enough hours in the day to study hard and study what's needed, as well as working up to almost full time as a student in nursing, if at all possible. As we know, we suggest at least less than 20 hours a week, and that's our goal for most students if they can manage that. And again, Susan is struggling with the difficulty of the major. I think we see that theme consistently with many of our students, that this is much harder than they expected. And as a result, their grades that they're used to, again, aren't what they want. And again, they have a struggle in that. Despite studying and using available time to, Susan is still only getting at 80% on her exams, and she may fail if she does poorly on the final. Again, all of this is contributing to high levels of stress. When we look at incivility in nursing education. It really is a phenomenon between stress that is excessive on both sides of the field. Students are stressed and many are overwhelmed, and faculty are stressed and most are overwhelmed. And when you have a cocktail of stress and stress, it can be quite the bubbling of the cauldron. As we look at Susan, her response, she's been increasingly frustrated by Joan, her current classroom instructor, who she feels is the reason for her poor examination grades. This may or may not be accurate. Usually it is not. Students need to own their part. And Susan, in this context, is not owning her part, but she's blaming the instructor and feeling that it is their fault that she is not getting the grade that she feels she should be receiving. Instead of addressing her concerns directly to Joan, Susan openly shares her negative opinions to other students as well as on her Facebook page. And I think that what we need to really recognize with our students is that many of them have no idea that the gossip and slanderous behavior that they have probably done most of their lives, especially in junior high on up, is unprofessional, uncivil, and is a part of the incivility that we see in our profession way too much. Therefore, we need to identify that to gossip and to slander and to not go directly to the source of her concern, which is the instructor, is unprofessional and behavior unbecoming of a student nurse who is soon to be a healthcare professional. We need to act like it before graduation. So therefore, these standards of direct communication need to really be communicated to our students, and recognizing that. She's also clearly violated social media policy that is likely in most student handbooks, that to basically put derogatory comments of a faculty or another student in social media is something that likely will be not without consequence, and was really something that was quite immature and inappropriate to do. But the problem is she's finding support by other students who are liking her comment. And when she tells other students about how this instructor is not that good, she's getting that validation. Yeah, you're right, I feel the same way. Well, what does that solve? Nothing, but creates a cocktail of incivility within literally the entire class. It's like the words of Christ who said, a little leaven leavens the whole lump. And when you have a leaven of incivility, if it goes unchallenged, it will leaven the entire class. And that's not okay. So it needs to be addressed directly and respectfully so that Joan can keep her reputation intact and Susan can make needed change. The dilemma now begins. Though Joan is a clinical expert in ICU where she practiced for over 20 years, this is only her second year teaching. Susan begins coming late to class and texting on her cell phone to other students even though Joan is lecturing. Joan is reviewing the most recent examination questions with the class when Susan raises her hand and states, "That question was written so poorly. I can show you from the textbook that your answer is not the only one correct. If you've never taught this content before, how can you be so sure that you got this one right?" Well, let's look at this using the lens of clinical reasoning. What data is relevant in this scenario and why? Now, Joan is a clinical expert, the faculty in intensive care, and has practiced for 20 years. This is only her second year teaching. I think it's important for both parties to recognize that no one is born a nurse educator, as well as born a nurse. It takes time and it takes experience to acquire the needed proficiency to become better in practice. Even Patricia Benner, with her novice to expert theory, recognized that it takes 2 to 3 years of experience to become even at a baseline competent level of proficiency. Therefore, it's important that students have an extra measure of grace and understanding to any newer faculty. What they lack in educational experience, they are rich in clinical salience. Therefore, they really are very good because they know what the nurse needs or what a nurse who is going to graduate needs for practice. But let's look at this scenario further. Susan's behavior. She begins coming late to class and texting on her cell phone to other students, even though Joan is lecturing. Is this acceptable or unacceptable behavior? Is it civil or is this uncivil behavior? Well, according to the literature, these behaviors of students that are commonly seen in most classrooms are uncivil behaviors that need to be identified as clearly disrespectful. Now, the essence of incivility is a lack of respect for the other party. Now, that can roll from student to faculty, lack of respect, or from faculty to student, a lack of respect. But recognize this, these behaviors are disrespectful and clearly are showing that the incivility and the animosity that Susan has towards Joan is basically continuing to perpetuate and exist. Joan is reviewing the most recent exam questions when Susan raises her hand and states this, that question was written so poorly, and I can show you from the textbook that your answer is not the only one correct. When we look at this response, again, clearly challenging, kind of having that adversarial, like I know more than you. I don't think I'm the only one who's experienced that from my students because it's in the literature as well. And when a student becomes adversarial and confrontative, that again is kind of the level of incivility is beginning to rise. It's not just kind of this low level passive of gossip and slander. It's now becoming more in your face. That is a red flag that needs to be recognized by the educator that is a part of this, and as a result, will need to obviously deal with Susan shortly. As we look at now the clinical dilemma, and let's resolve this dilemma. First question, identifying the data that is relevant. What is the essence of this current dilemma? Now, the essence is quite simple. It's simply student to faculty incivility that is allowed to progress and needs to be directly addressed very soon. Second question, what additional members of the nursing department could be utilized in this situation and why? Well, I think it's imperative that when you have a student who is becoming more adversarial, you must have higher level of departmental leadership involved, not just the faculty that's affected, but also the departmental chair. And therefore, it would be clear to have the three of them sit down and discuss this and make some clear decisions as far as where to go from here based on the handbook. Number 3, what is the priority? Now, obviously, it's Susan's uncivil behavior that's continuing and progressing from slander, gossip, and now to this adversarial. It's important to recognize this, though, that I have seen in my experience that there can be things spoken about me, even things on Facebook, if a student posts, that the nursing department has no idea is even taking place until it continues to escalate. And so therefore it's imperative that students hold their peers to the highest levels of professional behavior, and that when a student is hearing another student talking negatively about another faculty, another student, or the program, that the students don't just sit there and just shake their heads. They say, send the mail to the right address. Why don't you go and talk to this person that you have a problem with? Because I don't see this as being productive, and walk away. If students did that, that kind of validation that Susan is looking for would disappear, and she would be strongly encouraged to get the message to send the mail to the right address and really do that and be much more professional in her response. So fourth question, what interventions or principles can be utilized by both the student and educator to successfully resolve this dilemma. Now, I think it's important that, this is a learning moment for Susan. There's a lot of incivility in our culture. Just look to Washington and look at politicians and the lies and the deceitfulness and the animosity. We see that in our culture in so many ways that it really becomes acceptable. But in nursing, as professionals, we really need to use this as a moment to really teach Susan what is the definitions and boundaries of civility and respect versus incivility and a lack of respect. And again, the importance of emphasizing a respectful culture. Now, it's important to recognize Cynthia Clark in her research identified a dance of civility or a dance of incivility, depending if respect is present in the culture of the department. For example, when faculty consistently treat students with respect and understanding, they will get respect back. It's kind of like the biblical principle of reaping what you've sown. If you sow respect, you will reap respect as a result. Same is true with the students. When students respond to faculty respectfully, they will get respect back. And that is essentially so important in academia to recognize. So when incivility is present, for example, if faculty are being uncivil and disrespectful to students, they will get that animosity and incivil behaviors back as a result. It's also important to maintain and uphold standards of behavior that are outlined in the student policy handbook. Students are watching, and they must be followed through. Whatever consequences and boundaries of professional behavior must be supported and integrated in this scenario. It's also important to maintain an attitude of grace. I think that sometimes, again, students aren't aware that their behavior is crossing that line. But even if they are, we all need one mulligan in life, as well as in nursing education. And so recognize it needs to be addressed. But also don't let this define Susan for the rest of her years in nursing education. Give her a chance to respond and to hopefully change her ways. Also, teach strategies. Another intervention is to teach strategies to manage stress for students. This should be done in orientation because nursing, as we know, is a demanding major and is a high level of stress. We must prepare students for this, but more importantly, give them life skills on how to practically manage this. The importance of margin, the importance of rest, the importance of nurturing your spiritual life to maintain the balance so you do not burn out by the time you graduate from nursing school. Fifth question in this dilemma. What is the expected response that these interventions were effective? Well, you obviously would want to see the behavior change from Susan, but for me, I would want to see something deeper. I would want to see a heart change that would be manifested by Susan's recognition that what she had done was wrong and the need to ask for forgiveness. And if a student does that, that forgiveness needs to be given and again, restore that relationship. Number 6, what is this faculty likely experiencing or feeling right now? A recent study came out just in 2014 showing the lived result of faculty who have experienced student incivility was extremely revealing. Faculty expressed feeling anxious, worried, intimidated, stressed, upset, and even dreading coming to work. Some even had physiologic effects such as migraines, inability to sleep, and episodes of crying. And many faculty even questioned their desire to continue to teach and be an educator after experiencing patterns of incivility. It's simply not worth it. And that's tragic. And it's something that isn't okay. 7th question in this dilemma. What is the student likely experiencing or feeling right now in this situation? Again, we know that Susan is stressed, she's overwhelmed, but that is not an excuse for uncivil behavior. But what we don't know is her response to when she has been confronted with this. Would she do things differently? I think it's a great discussion to have. If your students in the class had been confronted with this behavior, what would they respond? How would they respond to this, to kind of being called out? Would they feel any guilt or remorse, or would they just kind of say, whatever, and move on? 8th question, this dilemma. What are the uncivil behaviors that were demonstrated by Susan in this situation? We've already talked about that, but again, I think it's important to summarize the essence of uncivil behavior. And the literature has numerous that are the most frequent in nursing education that students need to be aware of. For example, rude comments, engaging in side conversations, or dominating class is uncivil. Using your cell phone, texting, or inappropriate computer use with your notebooks, uncivil. Coming late to class or leaving early, uncivil behavior. Sleeping in class, uncivil. Anger or excuses for poor performance, inadequate preparation, pressuring faculty to get what they want, or bad-mouthing other faculty, students in the nursing program, all uncivil. So I think it's important to really communicate to students what these boundaries are in your student handbook so they know conclusively and without any question that they've been crossed and resulting consequences will follow. 9th question, the dilemma. How could civility be experienced in this situation instead of incivility? And again, it all comes down to respect. And our goal in nursing education as well as in practice is to have a respect and to honor the differences and to seek common ground with our colleagues and students. This is what we must seek after and must be our key objective as we want to cultivate civility in our programs. So therefore, creating that culture of respect is essential. Another practical intervention is for you as an educator. Role model what you want your students to become. Just like a small child with a parent, that student is watching you as a nurse professional. How do you respond? Are you uncivil? Or do we have kind of a sense of where it is well known that faculty don't get along? And there's uncivil or kind of insinuations that students can pick up quite readily. If that's the case, we are modeling incivility. And I think that's one of the reasons that we continue to see incivility perpetuated in nursing practice is because students too often see it role modeled by faculty. And that too needs to stop. And again, we need to support our students, recognize and have empathy for them. They are stressed, overwhelmed. They're doing the best they can, most of them. Bottom line is, give them that measure of grace and assume the best and not the worst of others. Finally, looking at number 10, what have you learned from this case so that you will incorporate into your practice? I have incorporated reflection so that as you present this dilemma and talk about incivility, talk about the elephant, you know what? Have students reflect and say, you know what? I learned some things. And you know what? I didn't realize that slander or just kind of talking negatively was really a big deal. I know it is now. Or I'll be more willing to confront it and walk away from it if I see it by my peers. More importantly, I'll call it out, not just walk away. So, important just to that importance of reflection. You could even make this a one-page paper that you could even grade at the end of this case study. So I hope you like this. I hope you can see the potential that these dilemmas can really kind of talk about the dilemma, but more importantly, how to resolve it and make this a win-win. And again, each of my case studies that I've created have a PDF student version as well as a fully developed answer key with recommended guidelines for faculty. And if you'd like to purchase that, go to my website, KeithRN, and click the Clinical Reasoning Case Study button. on the homepage for more information. And check out my other videos on YouTube. The channel is Think Like a Nurse, as well as follow me on Facebook at Think Like a Nurse, or follow me on Twitter at keithrn.com. And again, thank you for all that you are doing to be a part of the needed change and transformation that is so desperately needed in nursing education. Thank you.